could you tell everyone watching how they might be able to practically help their children or loved ones have less behaviours of concern? And I realise that's a big question, but is there just any general stuff that they could do or think about?
Yeah, I would say that the best way, again, is to really think of, as we talked about in previous videos, thinking of function, thinking of why is my child, why is this person that I'm working with, or my loved one, why are they doing this? Looking into some of the assessment tools that are out there. We had talked about the motivational assessment scale. We had talked about some ABC data collection. But really, if there's a behavior of concern that's unsafe, that's challenging, looking for that support in the community. So is there a PBS program? Is there a behavior analyst in the school? Are there any type of social supports that could be available? In the US, we have a variety of services, either in school or insurance funded. And we tell parents if these things are occurring to go, maybe some type of developmental assessment is necessary. So this, like I said, a wide question, because it may be an underlying issue like autism. It may be an underlying issue like a communication deficit. But the first thing that I would say is, if your child is having a challenge right now, thinking about why that's occurring and really looking into it, taking that data, talking to people, identifying, do they have the communication skills that are necessary? Is something working in one area? Are they able to is tantrum working with one parent versus the other, and being consistent? So the behaviors of concern, if they're really dangerous, if they're big behaviors that are a challenge, look for those additional supports. You don't want to have to do this on your own. It's very difficult. But if it's something that's manageable at home, really consider function, consider how to be consistent, consider how to generalize that to other family members, right? So just because you're putting a plan in place and that behavior is working with you, doesn't mean it's working with a sibling or with a spouse or with the aunt and uncle that they're visiting with. So considering function, making sure that we're consistent, and planning to generalize this away. But again, to be ethical and to make sure that we're covering our bases, if something is dangerous, if you don't feel safe, if you think there might be something more going on, look to the supports in your community, talk to people in the school system, see if you can talk to your primary care physician. Maybe a developmental assessment could be helpful to really work on things from behavior to speech and communication to sensory needs and things like that.
Thank you, Brian.